Hi, my name is Dan Kinney from Core Physical Therapy in Westlake Village. I've been a physical therapist for over 30 years, and I want to share with you talks about posture and how you can become better aware of what you're doing with your postures that might be leading to your injuries. The first thing is basic posture. Over the 30 plus years of physical therapy, I've noticed people are unaware that their head is forward or their shoulders are rounding. So I want to give demonstrations of what I've seen clinically over the years. Here's a person that traditionally comes to me, standing like this. They come to me with a shoulder problem or a neck problem or a back problem. So if I'm in this position and I try to use my shoulder, it's going to be limited. I can't go any further. And it's not until I get my posture in an upright position that now I can raise my shoulder higher. If I'm in this posture, my head is forward and I'm going to be putting stress and strain on my neck. Well, a lot of people think they just need to move their neck back, but that's considerably hard work. What I like to teach people is to be aware of what's happening in their full body. So if we can start to change things here in the low back, now you can see that the head is getting in a better position, and if we can adjust here into the thoracic spine, now you can see that my neck is in a lot better position, so now I don't have to do as much there. So when treating for one area, you really want to look at the whole body and not just treat the area. So if you are going for therapy and you have a shoulder problem, pay attention to what's going on with your body. So here's the next posture that I see a lot of, is where the pelvis is tilted forward and the back is swaying. When I'm in this posture, I have two options here. I can have my head up in the air, but I really can't see where I'm going. So my tendency is to, again, bring my shoulders forward and bring my head forward, resulting in rounding of the shoulders, putting stress and strain in the upper back, and also putting stress in my neck, as well as my low back. So what we want to really talk to you about is neutral spine. So if we can get you into a neutral position here in your low back, and we can get you into a neutral position in scapula or shoulder blade, now we're coming from a stronger place and we're relying on our bony structure and not on our muscles. I see a lot of patients over the years that come to me with pain in different parts of their body, and they really don't know why they have it. There is no injury, it just started to develop. And a lot of it is this postural biomechanical stress, because they're in one position for many years and now they're developing this dysfunction. So the body's starting to talk to them louder and louder. That hurts me. Because our community is more of a sitting community now, I'm seeing a lot more tightness and stiffness through the hip, pelvis, and low back, resulting in low back pain. So when we're dealing with a low back pain, we also want to look on what's going on with the pelvis and what's going on in the hip. So if I'm bending over and trying to reach for something, if my hip and pelvis can't move, it's going to put more stress and strain here. And if I also have the postural faults that I was talking about earlier, it's going to put excessive stress and strain. So it's really important to look at not just where you have your pain, but what the general area is doing as well, including the hip and pelvis. So the first step is becoming aware. Becoming aware of how you're using your body and why you're having this pain. So I want you to start to look in front of a mirror and see how you're carrying yourself. And if you're having problems with that, you should contact your physical therapist so they can point out what you're doing that might be creating this problem. So with posture, we really want to rely on the bony structure to really support us. That gives us strength. And if we're out of alignment from just the body posture, it's going to put stress and strain on the soft tissue. So one of the things that at core physical therapy we talk about is the core. And we talk about neutral spine all the time. Whether it's a shoulder problem, a knee problem, a hip problem, or a back problem, it still has to be a solid foundation in neutral spine. So what we come to the patient is we really talk to them about contracting the transverse abdominis or lower abdominal region and really get them in that neutral spine. So what we look for is my pelvis level, or is it rotated one way or the other? And we want to see if it's level. So we should see a nice level spine. So that's getting in neutral spine position. Then we want to look at the shoulder blades here, and we want to make sure that they're kind of retracted into a pinch position in your low back. So they're here, so your hands are at your side, and then we just want your head to be looking straight ahead like this. So those are simple things that you can do, and I always tell my patients little bits often, little bits often. Throughout the day, you're going to check in with yourself, whether it's sitting or standing, and try to correct. Do it for 5 seconds, do it for 10 seconds, but do it multiple times a day. So now you're becoming aware, and it brings your conscious mind into it, so you're not on automatic pilot anymore. So here's a review of your posture. I'm going to stand in a sideways position and show you what neutral spine is. Neutral spine is getting your pelvis in this position here, so you can see that I'm level. Anterior rotated pelvis is this, and a posterior rotated pelvis is where I'm squeezing my butt and I'm rounding in through here. So in between this anterior tilt and the posterior tilt is neutral spine. Then what I'm going to show you is what the scapula will look like when it's in that proper position. So you can see here that my shoulder blades are coming down and in, and there's kind of a pinching sensation, and my hands are right in by my side of my body. So I've talked about how posture impacts us in a static position, but it also impacts us when we're doing our daily activities, such as walking. So if I have a rounded shoulder posture and a forward head, that gravity is pulling me forward. So in my tall body, I'm going to start to walk with a bent knee. So if I'm walking like this, now all of a sudden my stride is shortened and my knees are bent. And with that, it's going to limit the strength that I'm getting from my quadricep and from my gluteal muscles here. And it also is going to compromise on my core. And when we're walking in that proper upright position, we should be able to take a nice full stride, and we should be able to activate our quadriceps, our thigh muscles, and our gluteal muscles, our butt muscles. That gives stability to the entire lower extremity, and also it will help facilitate our abdominal muscles by the counter trunk rotation that occurs. So when I take my step with my right foot, my upper body on the left side also moves at the same time, creating that contraction through the core and also into the buttock area. Now, the other piece I want to talk to you about with posture is not only does it impact the joint and the muscles, but it also impacts the rib cage, which is going to impact your respiratory. It's going to put compression on the heart, and in a bent over posture, it's going to put compression on my intestinal system. So people with postural problems are putting extra stress on breathing and digestion. So you can see that when your first grade teacher or your mother yelled at you to stand up straight or sit up straight, there was some benefit to that. I hope this helps you, and you'll start to become consciously aware of what you're doing to help yourself. If interested, check us out at coreptrehab.com.